Major depression is a mental health condition that shows itself as a chronic depression or dissatisfaction with external stimuli. This could be due to societal factors or biological ideas, among other reasons. Studies have shown that these factors may have an impact on brain function. Managing this mental health challenge is similar to juggling a wide range of emotions. Typically, you'll feel as irritable as a cat in the morning, with poor self-worth or difficulty seeing the bright side. You might also feel restless, difficult to focus, or become angry with the people you care about. You may have moments when you just want to be alone yourself, sleep more, feel incredibly exhausted, think that life is pointless, or notice changes in your weight, among other things. Some individuals with this illness have recurrent episodes, which can happen once a month, once a year, or multiple times over the course of their lifetime. Because they only go through phases of low or depressed mood, those with repeated severe depressive episodes are sometimes referred to as having unipolar depression. Dysthymia. Even while persistent depression doesn't seem as bad as major depression, it can nevertheless strain relationships and make daily chores challenging. Persistent depression lasts for 2 years or longer. Those who suffer from this kind of depression typically feel extremely depressed, for no good reason, poor self-worth, erratic eating, irregular sleep cycles, and memory problems. Additionally, their interest in things can change quickly. One moment they may be into basketball, but the next, they may be more into hockey. People who experience this kind of persistent depression may start to accept it as the way things are meant to be and develop a normal outlook on life. Manic depression. That means you have moments of extreme happiness. Mania or hypomania is accompanied by periods of extreme depression. A person with hypomania, a lesser version of mania, may have increased energy and a lower desire for anger during sleep. Rapid thinking, grandiose speech, thinking that increased confidence and self-worth, acting in an uncommon or risky way, and an intense feeling of exhilaration. A clinician must observe evidence of a manic episode lasting at least 7 days, or shorter if hospitalization was necessary, to diagnose this illness. A depressed episode is similar to having a major depressive disorder, and it can occur either before or after another. You may experience extreme sadness or a sense of being empty, lack energy, tire easily, have difficulty sleeping, find it difficult to focus, lose interest in activities you used to like, or even consider harming yourself. Episodes involving severe instances may include delusions and hallucinations. Additionally, you may experience mixed episodes, which manifest symptoms of depression and manic symptoms. Postpartum depression. The term for depression and weeping that follows childbirth is baby blues. This sadness is linked to significant hormonal changes after childbirth. 1 in 7 women may experience something more extreme than the typical baby blues. It's normal and normally gets better in a week or two. However, a new mother may develop postpartum depression or purified protein derivative if she has constant sadness, anxiety, or worry for several weeks or longer. Postpartum depression may be indicated by depressive symptoms lasting several weeks, withdrawal from loved ones, changes in sleep and eating patterns, and other symptoms. If you have these symptoms after delivering a baby, you may also be experiencing signals such as constant weakness, easy anger, racing thoughts, or anxiety. It's crucial to seek support and assistance from someone, such as a doctor. Seasonal affective depression. A type of depression linked to the change of the seasons is called seasonal affective disorder. Many persons who suffer from this type of depression have symptoms that begin and end at approximately the same time every year. The seasonal affective disorder usually starts in the fall and lasts through the winter, although it can also occur in the spring or summer. Its symptoms, which include fatigue, depression, and loss of interest in life, start slowly and develop worse over the course of several weeks. People who suffer from seasonal affective disorder also encounter symptoms including weight gain, heaviness in the arms and legs, cravings for carbohydrates, and relationship issues. Treatment plans may include medication, talking to a therapist, light therapy, or a combination of these. Psychotherapy, or talking to a therapist, is particularly beneficial, as a therapist can help identify negative thoughts and behaviors that impact your mood, teach coping mechanisms to manage symptoms, and teach relaxation techniques to help you regain lost energy. Psychotic depression. According to the National Alliance on Mental Illness, 20% of depressed individuals go through really severe episodes that involve psychotic symptoms. A person with a diagnosis of major depressive disorder with psychotic characteristics has a combination of psychosis and depression symptoms. Insane thinking or acting, such as believing untrue things or hearing or seeing unreal things, are examples of psychosis. Early psychosis is the state in which a person appears to be disconnected from reality. Early psychosis is characterized by symptoms such as avoiding social interactions, feeling intense and inappropriate emotions, cognitive difficulties, not taking care of personal hygiene, and struggling at a job or school. Psychotic depression is the most common cause of these symptoms. A depressed episode lasting at least 2 weeks that includes hallucinations and delusions must exist. Two categories exist. One contained content that was consistent with depressed themes, while the other did not. Premenstrual dysphoric disorder. Premenstrual dysphoric disorder, or premenstrual dysphoric disorder, is a hormonally produced disorder that occurs throughout a menstrual cycle. Though roughly 85% of women have premenstrual syndrome, only 5% of them are diagnosed with this disease, which is considered a severe form of the condition that many women suffer. The primary symptoms of this condition are depression and anxiety, but there are also behavioral and physical indicators. A woman must experience these symptoms during most of her menstrual cycles for a year, which must have interfered with her social or professional life. To treat the depression and anxiety symptoms of thrombosis with thrombocytopenia syndrome, doctors may prescribe specific antidepressants. Atypical depression. Even though it's referred to as atypical depression, your doctor may classify it as a severe depressive illness with atypical features if your symptoms of depression temporarily improve following a positive event. It's not unusual, and it doesn't imply that this form of depression is more or less severe than other kinds. It might be difficult to treat atypical depression because you may not always feel or look depressed. It may happen during a protracted depressive episode or a major depressive episode. Additional symptoms could be weight gain and increased eating, trouble with eating habits, difficulty sleeping or excessive sleep, everyday heaviness in the arms or legs, rejection and sensitivity to criticism, and a variety of aches and pains. Situational depression. A depressed mood, also referred to as adjustment disorder, is comparable to major depression, but is brought on by certain events or circumstances, such as the death of a loved one, a significant illness, a divorce, an abusive relationship, unemployment, or difficult legal challenges. It's normal to feel depressed, anxious, or to withdraw from people when things are difficult. But situational depression occurs when these emotions get out of control and interfere with day-to-day functioning. Symptoms typically start to show up 3 months after the incident and can include a lot of criminality, sobbing dejection, and hopelessness, shifts in appetite, difficulty sleeping, aches and pains, poor energy, trouble focusing, and avoidance of social situations. Disruptive mood dysregulation disorder. It is the time of year when children or teenagers frequently experience intense rage and outbreaks of fury. It's not just a typical bad mood. Children with this disorder experience severe difficulties at home, at school, and with friends. They may require extensive support, visit the hospital, be suspended from school, and develop additional depression problems. As they get older, children with disruptive mood dysregulation disorder may experience fewer tantrums, but instead exhibit signs of sadness or anxiety. As a result, the therapy they require may also need to be altered. Children with disruptive mood dysregulation disorder may experience difficulties in the classroom, struggle to maintain positive connections with family and friends, or have difficulties in social settings. Thank you for watching. Don't forget to subscribe and like our channel for more enthusiastic content.